Preventative medicine or curative medicine? Which is the better approach to healthcare issues facing the modern world? A common issue in healthcare at all levels is how resources, time, research and spending should be focused in treating diseases or other healthcare conditions when they occur, which is called curative medicine or curative care, or in predicting and taking steps to prevent those conditions before they occur, which is called preventative medicine or preventative healthcare. Curative medicine covers most of the things we immediately think of when we hear the word medicine, such as medications, surgery, chemotherapy, and physiotherapy. These are all responses to diseases or conditions that a patient has developed and a doctor or healthcare worker has observed. Preventative medicine covers all kinds of approaches to disease prevention. This includes preventative measures against specific diseases like vaccinations and screenings, as well as more general checkups and healthcare guidance to encourage good overall health and well-being in patients. Another aspect of preventative medicine is promoting public health at the societal level. This can take the form of government action such as mandatory vaccinations and public smoking bans, or it can be public health information campaigns and voluntary initiatives like wellness programs. Historically, most healthcare provision has been focused on curative medicine, but is this something that we should be looking at changing? Chronic conditions like cancers, cardiovascular diseases, diabetes, obesity, these are all the leading causes of death and disability in the modern world, especially in developed countries, and they take up a huge portion of medical spending and resources. Preventing these conditions occurring by minimising the risk factors that cause them is ultimately better for patients than treating them after they occur, as well as significantly more cost effective. The COVID-19 pandemic demonstrated the limitations of curative medicine in responding to an unpredictable health situation, and the importance of preventative measures to maintain good health and reduce vulnerabilities among the public, ultimately saving lives when something like a pandemic actually occurs. But there are many barriers which make it difficult to shift from a curative to a preventative approach. So much of the healthcare infrastructure is focused on curative medicine. It would involve a major systemic change, and that would take a really long time in order to refocus it heavily on preventative medicine. There are widespread perceptions that medicine is about treatment, not prevention, especially amongst patients, but also among other stakeholders and decision makers such as healthcare providers, insurance companies, and government policymakers. Changing these attitudes can be really difficult, especially when it comes to investing money, time, and resources in preventative healthcare. There are legal and ethical considerations about how far we can go in preventing unhealthy lifestyles and behaviours, both in patients and at a public health level. Health and health risks can be impacted by factors such as poverty and pollution, which sit outside of the field of medicine. To effectively promote good health and prevent illness, we must address these other issues too. In conclusion, preventative and curative medicine are both vitally important approaches to healthcare, but preventative medicine is far too often neglected, and this comes at a really heavy cost, both in monetary terms and human lives. Focusing more attention and resources on preventative care is something we should aim to do at all levels of healthcare, but this is likely to be a slow and difficult transition involving changes in infrastructure, funding, policy, culture, and attitudes.